Welcome, everybody. Just to make sure you're in the right spot, this is going to be on Let's Talk Aviation Mental Health. My name is Paul B.J. Ransbury, and I'm the chairman of the NBAA Safety Committee, and it's a great honor to be part of the event and to see everybody here today. Thank you for coming to spend some time with us. I believe the session's being recorded as well, right, Mark? So that's going to be, if you find this interesting and shareable, then that resource is going to be available to you. Before we get started, I want to talk a little bit about what's going on here. And this is what's called the Safety Education Center. This is different this year. It used to be just a Thursday event at NBAA, but now with the double down on safety, we now not only have our single pilot safety stand down on Monday, but National Safety Forum is Tuesday afternoon, Wednesday afternoon, and Thursday morning. And if you have a look on the list, you can see now we're about the third bullet down on aviation mental health. And we're going to be starting up tomorrow on Wednesday and Thursday to finish up the rest of the list. Now, if you're looking for the agenda, that QR code will take you to the agenda to find the different areas of National Safety Forum or to be able to see the schedule to get yourself set up. All right, next slide, please. If somebody can advance it, great. Wonderful, thank you. Advertisement for the NBAA Safety Committee. It's a great group. We have 5 teams. We have 14 working groups, over 70 volunteers. We continue to evolve and diversify. So if you have a unique area of expertise that you feel would help make business aviation even safer, that QR code on the screen right there is where you can apply to volunteer your time to help the committee. And so it's exciting. We work hard. We do a lot of work. And most importantly, our job is to make sure if you do volunteer that your time is invested and it's going to be used. And it's going to be something that's going to be able to impact the industry. So with that, let's go to our next slide, please. For our sponsors, we couldn't do any of these events without them. Textron Aviation, Corporate Aviators, and Standard Aero, a big thank you to them. And they're sponsoring the entire week, which is great for the Safety Education Center, so very much appreciated. Let's go to the next slide, please. This is where you can go if you want to submit a question during the presentation. I believe at the end there's going to be an opportunity for passing the mic around, so you can do it live, but if you want to get something in queue, you can go there and submit those, and we'll make sure we have somebody in the back watching those. So let me just talk a little bit about this event. It's just fascinating. And I'm just going to read the first paragraph that's in the app. And by the way, you do have the app that describes the event, then also details on the speakers if you want that'll be presenting today. And I just wanted to read this. A significant portion of the population, 55% of adults, will face a serious mental health challenge at some point in their life. Now, exacerbated by the pandemic, 1 in 3 adults will face a mental health challenge in any given year. So they're going to be talking about that with some true experts on the topic up here today. So it's intended to be interactive with a Q&A at the end. And moderating today is a good friend of mine, Mark Larson. He works with us on the NBAA Safety Committee. I just want to read a little bit about Mark and his background. Very accomplished fellow. He's a CAM and is the Director of Safety and Flight Operations at NBAA. In this position, he oversees NBAA safety and flight operation initiatives and rulemaking efforts with the FAA, Department of Transportation, and National Transportation Safety Board, and serves as a staff liaison to the NBAA Safety Committee. That really explains why Mark is so busy all the time. And he does a great job. Great guy, a humble man. He's excellent at what he does, and today he's going to moderate. So Mark, thank you for doing this, and over to you, sir.
Absolutely. Thank you very much, BJ, and thank you all for being here. So I want to start for just a second and ask the room a bit of a question. So how many of you have ever found yourself concerned for the mental health of maybe it was a friend, family member, or a colleague, perhaps even yourself? So I see some hands raised in the room, and certainly heads nodding beyond that too. And just as BJ alluded to, pre-pandemic, this was an issue that notionally affected about 1 in 5 adults in any given year. With the pandemic, studies are showing that that's north of 1 in 3 at this point now too. And so when we look at this, really want to find ways to help address this, and we want to have those healthy strategies for some of these issues. Life can be stressful at times. That's kind of part of life. But what we want to talk about today is how do we effectively make that. And if we could, go ahead and we'll bring Matt up here too as well. So for our time today in discussion, I want to talk about really what is mental health, and what are those common mental health challenges, recent events that maybe have brought some further attention to the topic of mental health, how can we support our mental wellness and that of others in our profession and in personal circles as well. And perhaps you're thinking, all that is great and well. What about FAA medical certification, which ultimately is a key issue on many aviators' minds beyond that. And as BJ alluded to, we will have time built in to take your questions. So we've got the QR code. Encourage folks to submit your questions that way, as he covered. So for these discussion topics, I'm pleased to be joined by our panel today. And so first, opposite me here, Dr. Susan Northrup is the FAA's Federal Air Surgeon. She leads the Office of Aerospace Medicine there, including all the policy development, application, and oversight roles of the Airman Medical Certification and Appeals process. She's a retired Air Force colonel, is a licensed pilot herself, and is board certified in aerospace medicine with medical degree from Ohio State and master's degree in public health from the University of Texas. So thank you for joining us, Dr. Northrup. Also with us online, we've got Matt McNeil, who is founder and clinical director of LiftAffect. He is a licensed professional counselor and a board certified coach. He is also an ATP rated pilot with corporate, charter, and airline pilot experience. He holds master's degrees in aviation safety from Embry-Riddle Aeronautical University and clinical psychology from the University of Wisconsin at Madison. He is also an NBAA Safety Committee member on our Fitness for Duty working group. Thanks for joining us, Matt. And then also next to me is Dr. Beth Burke, who's the Associate Dean of the John D. Deger School of Aerospace Sciences at the University of North Dakota. She's an aviation professor there, a pilot and a flight instructor. I actually had her as my instrument ground school instructor when I was there years ago. And she has led research into the pilot workforce and initial training success, as well as mental health and healthcare seeking behaviors among aviation professionals. So thanks for being here, Dr. Burke, as well. And as well, so BJ gave a little on my background. I've been with NBAA over 18 years at this point in various operational capacities, and then have the pleasure to serve as our staff liaison to the Safety Committee and really work a wide range of safety issues, including this one. So thank you all for being here. I want to take just one quick minute in terms of a little background of kind of how Fitness for Duty came to our top safety focus areas. So 8 years ago in our typical deliberations of those generally top 10 issues, we were finding fatigue and issues like sleep apnea and a host of things were kind of coming up, and it's like, well, how do we kind of cover all of this? And ultimately found that kind of umbrella term, Fitness for Duty, that could encompass all of these pieces. And then the Safety Committee today, as we've further refined that, really looks as kind of three core areas of that. So any physical, health-related issue, that's sort of one key facet of that. Aviation mental health as a second, and then thirdly, fatigue being a key piece standing on its own. And so that's by way of a little background with that, let's maybe start into the questions of our panel. And with that, let's maybe just take one quick minute, if we could, to kind of just level set with everybody. So Matt, could I start with you in asking what exactly is mental health and why is it important in the broader context of Fitness for Duty? So we had some of the context there, and then when it comes to mental health, are pilots the same or different than any other adult?
So that's some big questions got there. I'll try to make it brief. Mental health, the way I conceive of it is it's really everything between your two ears and likely some of what's in your gut. Mental health it includes emotional, psychological, social well-being, and it affects how we think, how we feel, and what we do with our arms and legs and our mouth, how we act with our behaviors. And so our mental health, how we're feeling, our level of health determines how we relate to others, how we handle stress in our environment, either internally or externally, and what choices we make. So mental health is important I get rid of this, across lifespan. From the time you're born all the way to the if you make it to be very old, if you're lucky enough. Lots of factors contribute to it. Biological, we think some genetic stuff, some brain chemistry stuff. We know about this much about it because again, the brain is the most complicated ecosystem and machine in the universe. But our life experiences, affect our mental health and our family history, we think has an impact as well on our mental health. So fitness for duty, when pilots are struggling with mental health issues, we certainly know that absenteeism dramatically increases, along with their ability to get along, how they relate to others. And certainly in the training environment with added, which is a very stressful event for people, that's where we see psychological decompensations that result. Now, with that said, there's very little data on the negative effects of mental health on actual flight performance. We don't know. And from our experience with pilots, when things are bad enough, what certainly we see in our practice is pilots they call out sick, they don't go to work when their subjective experience reaches a brewing point. But pilots will push pretty hard. They will keep going. And, I would say with the high number of pilots that we treat at LiftAffect, many of whom are still flying, this in context to the low numbers of pilots that actually seek professional help and that report their conditions, I think, it's difficult to say that pilots with mental health problems negatively impact safety. We don't know that. We just don't, there's just not enough reporting. There's not enough data on this stuff. And we certainly aren't seeing accidents and incidents and violations. So again, there's not a lot of data on this. I think there's a lot of room for further exploration in this. And as mental health becomes more to the forefront, which is exactly what we're doing, I think this is a great place to start to have some of those conversations. Are pilots more different? As far as immunity to mental health issues, absolutely not. Which you can refer to some very basic studies that have been done in recent years on this. And I think we can make an argument that pilots are more susceptible to issues because we have things like circadian disruptions and chronic geographical displacement, the pressures of just the environment in which we operate in, stigmatization that's very high, the pilot as Superman on the chest, the right stuff, that kind of thing. And then there's regulatory oversight and fear of punishment. These things, I think, leave pilots as actually a bit of a vulnerable population to mental health issues. So that's did I hit all of the questions you had? I tried.
You did. Thank you, Matt. Thank you. Dr. Northrup, can you give us some context here in terms of how the FAA sees mental health in that broader aeromedical context?
So we're concerned anytime there's a potential for a sudden or subtle incapacitation. And there are some very celebrated events where people committed suicide with airplanes and occasionally took a large number of people with them. So it's important that one consider that mental health is part of one's overall health, and there's a continuum in all of this. Some stress is good, so that you respond to an event that requires your attention, and you respond in an effective manner. You get a gear warning light or something like that, so you do something, or you get a call from home and you need to go. The trick is figuring out where you've gone from appropriate responses to stress to inappropriate responses to stress. And in the aeromedical context, I agree, a lot of it probably is not discussed because of the stigma, because of the myth that's out there, that if you ever get a mental health diagnosis, you will never fly again. Now, 25 years ago, that was probably true, but it's not true anymore. And in fact, we've gone to great lengths to begin to put in the Guide for Aviation Medical Examiners some really good grids for PTSD, for early mild depression, situational stress reactions. It is far easier for us to handle a mild to moderate depression or anxiety than it is for somebody to think that they can't get the help they need because of the love of what they want to do. Once you get to the point where they've gone to severe, or God forbid, recurrent severe, and may not have told us about it, and they do something active, now it's hard to come back from. Now it's really hard to come back from. And I'll freely admit, there are some mental health diagnoses we're just not going to entertain in the air. I don't need somebody that hears voices other than the ones they should be hearing in the cockpit of an airplane. People that routinely abuse alcohol and can't get sober probably don't need to be in the airplane. But again, those individuals, you got to look. Is there something that they're treating with the alcohol? And frequently when we deal with alcohol or drugs, it's a dual diagnosis, so there's more than one. We can still get a lot of those people back in the air. But again, I need the help of the people in this audience to get out there and let people know, get the help you need when you need it so that you have the tools to deal with it before it becomes so bad that it affects your performance. So that's another paradigm we're starting to struggle with within aerospace medicine, and that's getting people to consider mental health part of their performance, because it will affect their performance. Short-term, long-term. Again, sudden or subtle incapacitation. We don't want somebody in the air that isn't fully doing what they should be doing. As far as certification, you've probably heard the overall numbers that on average, we get 385,000 applications for medicals a year. Last year was a banner year. We got 410,000, mostly first-class young people. Yay. About 10% of those end up with a special issuance or a special authorization. About 1% end up being initially deferred or denied. Of those, the vast majority failure to pursue, so they just don't send us paperwork. Of those that send us paperwork, the number that are final denied, it ranges between 0.1 and 0.2%. You may have seen those numbers. You may have heard those numbers. When we tease out the mental health diagnoses, across the board, better than 90% get back in the air. I don't have exact numbers on that because I'm still teasing through our data systems. But I hope when I come back in future years, I'll have a better visibility on what those are. Initially, the deferral denial rate's probably closer to 20% in the mental health arena. But again, we get the vast majority back in the air. If you want to see what we require, at least to the initial list, go to the Guide for Aviation Medical Examiners. And if there's someone with an alcohol or drug program, there are checklists, as well as many of the other diagnoses. At this point, our SSRI, Selective Serotonin Reuptake Inhibitor program, is 12 years old. And we've got over 1,500 pilots back in the air through that program, which is pretty awesome. We recently did a deep dive into some of the data associated with that to see if there was a way, because right now it's a pretty onerous process, if you know anybody that's been in it, with annual mental health evaluations, annual neuropsych testing, and we're trying to determine if we can spread the requirements out some, or if there are other tools that we can use. So as I said this morning in the Meet the Regulators, we have a study right now that's enrolling people. We're looking at other tools and trying to norm them to the pilot population so that it's more than the COG screen, which is kind of difficult to get in some areas of the country, but some of these other metrics are going to be much simpler. We're looking to add medications to that list. Initially, it was for just uncomplicated depression. About 2/3 are still that, but we have people with anxiety, we have people with mixed depression and anxiety, we have folks that are using antidepressants for significant pain control. So the program itself is getting bigger. In an effort to get more people through the system in a timely manner, because I freely admit this one takes a minute, particularly for the first one, I now have 4 psychiatrists on staff and another couple that are contracted with us to do additional work. So hopefully those numbers will be coming down for wait times.
Excellent.
I'm going to toss it back at you.
Thank you. Yeah, I know that was covered a lot of waterfront there too. Definitely matches a lot of the conversations that I've had with folks and the areas of concern. So definitely glad to see that those are issues that you guys are having those conversations actively and working forward with that. Beth, could we take a second to, maybe more than a second, sorry, but here. So what really brought the topic of mental health to the forefront of minds at UND?
Thanks, Mark. So for those of you that aren't familiar, the University of North Dakota, we have just over 2,000 aspiring aviation professionals. So I have the privilege every day of working with the next generation that we're going to see take over our industry. As we all know, we all live through a crazy pandemic, as well as social kind of unrest in the nation on a period of 2 years that I don't think anybody would want to live through again. And I think it took everyone's mental toll to get through that. On a college campus, there's a lot of research that shows that individuals are successful in college when they can integrate both socially and academically in that academic program. I know we have a couple students in the room, so I don't want to speak for them, but a college campus in the fall of 2020 was nothing like I had ever seen. Students were living alone in dorm rooms. They weren't allowed to have lunch together at the dining center. Everything was takeout only. Classes were all spaced at least 7-8 feet apart at our university, or primarily on Zoom. It was rather, incredibly depressing for these students that, moved away from home, trying to integrate into this college setting away from their family and peers, and not being able to meet new friends, new peers, and have that sense of belonging. In the fall of 2020, just before classes started, we did lose a recent alum, died by suicide. And so that was kind of the first indication of we're kind of coming into uncharted territories here. I've been in academia for over 20 years, and I can count on one hand how many student deaths I had to deal with as an administrator. Fast forward January of that year, we lost a first-year student. It was a veteran that was in our program, pretty much all remote, also took his own life. At that point, then it was, definitely raised concern at my level, so I created a mental health and aviation mental health task force within our university. I leaned on my mental health experts from our counseling center, our AMEs from student health, our psychology department, as well as our aviation faculty, staff, and students to start thinking about what can we be doing different? How can we improve what we're going through? We don't see us coming out of this pandemic anytime soon, and this is scary. There's no research yet to show the impact on the pandemic, especially on this younger generation, but I do not like where this trend is going. And so we started implementing different things in our curriculum. I learned about all the great things that the airlines and business aviation were doing in this realm. Took a look at the FAA rulemaking committee that came out in 2015. And then, unfortunately, 1 year ago today, October 18th, 2021, our student John Hauser ended his life in one of our university aircraft. And that was definitely, the sucker punch that said, okay, we can't just be talking about this here locally. We need to do something bigger. And we held our first Aviation Mental Health Symposium in Chicago in December of 2021. I think one of my first emails was to Dr. Northrup. She sent 2 of her FAA staff to attend. We had 7 universities in attendance. We had trade associations. We had airlines. We had mental health experts, AMEs, and really start that conversation on how can we work together? What kind of things can we embed into our curriculum? Peer support, front and center. How can we create that in our aviation programs? I do want to put a little plug. We want to continue this conversation. We're holding our next symposium in November, just next month, at the campus of UND, where again, we want to continue this dialogue, this collaboration, and discussion.
Excellent. Well, thanks, and looking forward to joining that event next month with you, and good to be back in Grand Forks then too at that point. So, thankfully, not every mental health issue involves thoughts of suicide and things like that. It certainly could. But Matt, as a professional counselor, you've got deep insight into the mental health challenges often faced by your patients. What are the most common mental health challenges that you're seeing, especially among pilots?
So it depends on which demographic of patient, because they're not the same for us. We treat a lot of pilots, and the average age of our client is about 56 years old. And then the other highest demographic is between the ages of 26 and 32. And so the issues that they have are not quite the same. The young ones would be more of this than the mood disorder in actual, general anxiety disorder, severe depression. With the older crowd, they're just worn out. They're just tired. And so a lot of what we see looks like depression, anxiety. It's just fatigue. There's very, very deep fatigue, which is, COVID was, if anybody's an airline pilot, and it's certainly for corporate pilots as well, it's been rough. It's the amount of work and the schedules have been horrible, and they're throwing more money at the pilots, right? And pilots like to make money. So they just say, okay, I'll go out and I'll do more and do more and do more, while I'm getting triple time and double time and triple time. And you hear these, ridiculous amounts of money that pilots are making, but they're wearing themselves out. And certainly among the older generation, these are not people that have, a lot of them are not, this is not their first time having a mental health issue. Most of the time that's been going on for years to decades. And they just reach the end of the line where they're raising the white flag and they're tapping out. But anxiety disorders, probably 70%, and what we call anxiety disorders. Depression, 25%. Sleep issues, 100%. Sleep is the first thing to go, usually, that we're seeing. And then substance, alcohol. HIMS is such a defined program that that we don't see a huge amount of that, but there is, as Dr. Northrup said, there's a lot of co-occurrence. I mean, I don't know any person with alcoholism that doesn't have a co-occurring mental health issue along with it. And the alcohol is often used to, try to help with sleep, and just, it's used to self-medicate. So that's typically, and then there's the training stuff. I have a title, it's the Director of Human Performance. A lot of what we're doing is performance related things. So is that anxiety or depression? It's performance related. And we just use performance coaching, and it seems to resolve quite a bit of that. We have a very good success rate.
Excellent, thanks. Dr. Burke, you had talked about a lot of the challenges that were happening during the pandemic. Are there things that you see within the student population, sort of normal times, and just kind of the realities of aviation aspects too, that are the mental health challenges that they're experiencing in that transition to adult life as well?
Yeah, we're fortunate. We have these aspiring aviators young in their career. Again, we do see, individuals, especially with this generation, I think they're much more willing to seek help, but then how to navigate that FAA process. And that's a difficult place that we have, is helping them navigate that process. One of the things I do see that's happening with this younger generation, there's so many great opportunities out there with business aviation, with the airlines, that it's almost, how fast can I get through college to get to that dream job? And so they put this undue pressure on themselves on how fast. They want to graduate in 2.5, 3 years. 4 years seems like too long these days, because they're worried it's just gonna, the hiring's gonna stop. And so then when all of a sudden they learn, but if I need to take care of myself and go through the SSRI process, that that might take 6 months. And if you're only 18, 19 years old, 6 months seems like a very long time. Now, the older you get, and I know by experience, 6 months goes very quickly. So trying to get these students to just slow down, take care of themselves, and realize that they need to, be healthy themselves, navigate the process to have a longer, successful career and life. But again, that's one of the biggest challenges you see, just that undue pressure that they put on themselves to try to rush through that training as fast as they can.
Thanks, completely understand on that. And Matt, I'm going to go back to you for just a second here. So you had talked a little bit about coaching and kind of that performance aspect, but
Mark, I can't hear you. Your microphone is not coming into my ears. So I can hear. Yeah, why don't you try that? There you go.
Thank you. Let's see if this is working out any better.
Perfect.
Okay.
I hear you great. Okay.
So we talked a little bit about, performance coaching is kind of be one of those key aspects, but in terms of mental health care, there's really a lot of options that go beyond that. Can you give just, some sense beyond, and sort of, and there'll be a follow-up question of sort of, where does that interplay then with some of the FAA aspects? So you talked about coaching, but, when you get into counseling, other types of therapies and things like that, can you give us just a little flavor of what that all looks like?
I think I understand your question. I'm not sure. So, there's mental health counseling, which is psychotherapy. There's family therapy, there's individual psychotherapy, and then there's coaching, which is different. The only coaching that we do is mental skills coaching for performance, right? Check-rightitis. These, you have people that have had check-rightitis for 25 years. I mean, where they're dry heaving for 3 months before their check ride. And it's like, okay, that would look like anxiety, right? But it's very situational. And so that's a case where we get in and we do the coaching. And then if it's something more, right? If it's like, this is not really helping, and it seems like this is still continuing on, it's carrying over, then we sort of we move more into the psychotherapeutic, the psychotherapy realm. Did I get your question right?
Yeah, I think you kind of hit on to that, just to understand. And then for Dr. Northrup, is there a difference from an FAA standpoint in terms of when I've got to go fill out that medical certificate application? So yeah, there's some of those boxes that we've got to check. What happens for coaching and things like that versus psychotherapy or that, or what are the depending factors then when it comes to filling out that form?
So the block in question is 18M and 19, where you have to report medical visits. So essentially, marital counseling, family counseling, coaching, you don't have to report. The minute you go down the psychotherapy route, the minute there's a diagnosis, now you need to tell us. Have a conversation with a pilot advocate or your AME. There's lots of groups out there that have, Matthew could probably answer many of these questions too. Reach out to the people that are working with you to see what best to do to report. Now, the other thing I've occasionally seen people get into trouble with, if they go for counseling and somebody's billing your insurance, double check that they didn't give you a diagnosis, because I've seen that show up in falsification cases.
That's definitely been an issue that's, go ahead, Matt, please.
That's a very good point. And like at LiftAffect, we don't take insurance because we're all over the place, right? And pilots are all over the place. Diagnosis is required for insurance reimbursement. And you need to be very careful with that. Now, what we tell LiftAffect is we don't have reporting requirements to the FAA to anybody. We encourage our pilots to report. We tell them there's a couple options that are going to happen. Nothing. The 60-day letter saying we want further documentation of what's going on, or you don't have a medical, you've got 60 days to get a psychiatric evaluation. And Dr. Northrup, you can, confirm if this is what we find, but we encourage our pilots to report. And, the SSRI protocol, we get 100% of our pilots back that go through the SSRI protocol. The problem is not getting the approval. The problem is the timeline and coordinating. Not all neuropsychologists are the same. Not all HIMS AMEs are the same. Not all HIMS psychiatrists are the same. And it's I can say it's not 6 months. We've never had a pilot go back in less than 18 months going through the SSRI project. 9 months from when they send in actually, we just had an 8-month one, which was a little quicker. So we're kind of happy about that. But it's the problem is not getting people back to work. The problem is the time. It's coordinating the care. There's a lot of moving parts. And it's not all created equal, and the inconsistencies with the subcontracted AMEs and stuff, what they charge and what they want and this and that I think there's a lot of room to be improved. But I encourage pilots, you don't need to be afraid. It's a process. It's going to take time, and it needs to be done a certain way. I mean, the reason things don't get approved is because they didn't follow directions on what was needed. Most often it's not because, you have depression, you're not going to fly anymore. So I just wanted to throw that in there.
Yeah, and we're worried about that timeline as well. In fact, one of the initial ones are taking longer. I can't lie about that, but the renewals are a lot faster now than they were. And as I said, I've gone from 2 psychiatrists. My third one came on board early summer. The fourth one, I just signed his firm offer letters. So I'll have a fourth one here before the end of the month, and that'll help speed everything up. But Matthew's exactly right. I hate it when I see packages that come across and they are missing half of the documents we require, because now I have to send a letter, or not me, one of my staff members, and that takes a minute to get to the individual, and then they got to collect the stuff, and now that comes back to us, and then we have to look at it again. So checklists are in the AME guide. Use them.
I got it. And so I know we talked a little bit about this with the antidepressant use before, and so certainly, yeah, in some cases that's going to be medically appropriate, and we've got that. So at a very high level, in terms of some of those policies for the use of antidepressants, we talked 6 months stable dose is kind of one of the key aspects. Some of the evaluations needing to use HIMS AMEs.
So there's levels of use of antidepressants. Some people go on them for 4 months and they can get off of them. Those are a lot easier to handle. The people that need to be on the medication, and right now we only accept one, you can't be on two. They've got to be stable for 6 months. Used to be a year,
Okay. Yeah.
but it's down to 6 months, and we are in the process of evaluating that again. It's something we look at every couple of years. And then they can gather the paperwork and submit it. And hopefully very soon I'll have more than just 4 medications. Now, Matthew mentioned something else that I just had a conversation with one of my psychiatrists about. When you're treating somebody or you're seeing somebody with depressive type symptoms, it's really important to do everything else that's underlying too. Sleep is incredibly important. Incredibly important. Taking care of yourself, eating right, exercising, doing all the things you can do to maximize your own health will help you with your mental treatment.
Excellent points there as well. Let's see. Covered that one.
We're getting you off your
It's okay. I mean, believe me, this is you laid this out here, but we're covering the questions, and at the end of the day, that's what I was really hoping for in our time today. So let's talk a little bit about some of the hesitancies to seek treatment. I mean, certainly within mental health, we touch on this a little bit. I mean, is there anything else we can kind of offer, just ways to think about for anybody that may be hesitant to seek that treatment, much like John was in his case, and for fear of that long-term career implication. Thoughts on that one?
I'm not necessarily talking about hesitancy, but I'm talking about access. So the state of North Dakota is an incredibly rural state, like many states out there. We have right now 10 AMEs in the whole state of North Dakota. Half of those are probably close to retiring or also retired. We have 0 HIMS AMEs. So even if one of our students wanted to seek help and go through our local AME at Student Health, the closest HIMS AME is a 6-hour drive away, and that's going to take an individual out of classes or out of, so that's a real issue. I know Dr. Northrup and I had a great conversation over lunch, just how do we increase the access? Because again, they may want to seek help, but then that process is just another big hurdle that we need to make sure we're cognizant about. It doesn't seem like new AMEs are coming on or HIMS AMEs as fast as ones are retiring in this nation.
Got it. Great point there. And for all the calls and things that came in that I had, I was curious. I live just outside of Sacramento in a suburb, and it was like, where's the nearest HIMS AME to me? 2 hours and 15 minutes away on the northern end of the Sonoma Valley, or 4 hours down to Fresno kind of thing. So that's California with a lot of pilots.
So a plug, if you know any doctors, especially if they own an airplane, I'm looking for AMEs. I have areas of the country that are underserved, without a doubt. I'm also looking for HIMS AMEs. Now, the HIMS course is only taught in September for the basic, and there's a process to go through to become one. You have to ask us to be one, essentially, and then we vet. But yeah, I'm desperate. And if you know a doctor with the airplane, right now they can write 50 hours of flight time off their taxes. I'll try anything.
Excellent. So one of the things I was hoping to talk about, and you covered some of this too, which matches having gone to the HIMSS conference this year in Denver to hear that, when you said over 1,500 on SSRIs. Do we have that broader sense yet, or is that coming in future years for those other medical conditions, or other mental health conditions, I should say, that have been reported? And just trying to get that sense of where we're at when we talk about that, relative to the 1 in 5 or 1 in 3 kind of numbers in the adult population.
So those are the ones that require the HIMSS, or the SSRI program. Mm-hmm. I got a lot more that just had, stress causes our bodies to react. And by the way, that can be good stress or bad stress. When you actually look at levels of stress, getting married is almost as bad as a funeral. When you look at the points that several of the tools have put in there because of what's happening in your life. So it's a cumulative thing you have to worry about. And then we're trying to shove some of the decisions down to the AMEs to the extent that we can. I mean, we continuously go back and look at how these things are performing. And I have hopes in the not too distant future that, much like I had an oncology summit and a neurology summit, that we're going to be able to get one for psychiatry and psychology. Because things are changing. I mean, even in the field of ADD and ADHD, there appear to be people in that diagnosis arena that we may be able to get back in the air. And it's a matter of figuring out what tools would give us the comfort that we could do that.
Got it. Excellent. And maybe kind of another one just for the audience a little bit here too, about the SSRI use. So in putting that into context, there was a CDC study released kind of for the 2018 timeframe that notionally about 13% of adults on average overall are on an SSRI. That number's lower for men at about 8.4% and higher for women at about 17.7%, give or take. And so I did find on the FAA website, had some statistical data at that point that was showing at that point in time just over 800 applications for SSRI use on their medical, and the number approved was lower than that, which, legit reasons we talked about here too, why that may not have been a situation where you could have approved that multiple or other things that have happened. So, definitely looking at that and happy to see the numbers growing in terms of approvals and everything else from this year with more updated data.
Yeah, I'm living for the day that I don't see an autopsy report with toxicology that somebody has a mental health medication on board and we didn't know about it. And it still happens.
Understand. Yeah. So let's see, we talked, we talked, that your working policy changes and things like that in terms of the mental health medical certification, that kind of piece, knowing that we've got things like FAA reauthorization coming up next year. Are there additional resources, research, things like that ultimately would help your office in trying to, per se, move the needle forward on this one as well?
Oh man, that's a loaded question. Money's always good. But I compete for dollars with a whole bunch of other people in the federal government. But this is one of the high profile issues that we're dealing with. I do have research dollars allocated to human factors. And the study that we're trying to find the other tools to get them normed to pilots. More people would always be nice, but, write your car. No, I'm not going to say that whole sentence out loud. So we're working it. We are getting, like I said, I've added 2 psychiatrists in the last year. I have a neuropsychologist. I have 2 PhD level psychologists.
Okay.
I've got a neurologist on staff now.
And for those studies, are there ways to make sure that business aviation can be well represented in,
of course.
in our
Of course, we are
pilots?
enrolling people, and I want a wide range of people, and it's anonymous. We don't know who these people are, so we can see what the normal bell curve is for high school students through octogenarians and past that. Because we have pilots flying well into their 90s. I think my oldest pilot right now that's active is 100.
Wow, that's good stuff. Okay, and then, like I said, hopefully folks would intervene early, but just a thought, and seeing some kind of the bigger picture things that have been in the news around mental health, broadly. So, Matt, if someone lets me know that they're having a mental health concern, or even if a person themselves feels that they're suffering from mental health condition, what can they do? What resources are available to seek that help and that treatment as may be appropriate?
Well, the peer model is a first step, because pilots are comfortable talking to peers. Now, with that said, if you wake up and you pee and there's blood, you don't call a friend and say, do you think I should go to the doctor? You go to the doctor. And so this over-reliance on peers, we need to really be careful of that. LiftAffect works with all of the peer programs. They refer tons of pilots to us, and making sure that the peers are trained and where there's very well-defined referral thresholds is the most important piece. LiftAffect is pilot only. We only treat pilots. We're all professional pilots. We're all mental health professionals, psychologists or psychotherapists and coaches. Going to having some viable resources that understands pilots, understands the FAA, understands your environment, understands you, is a common factor in efficacy. right? And so that's what LiftAffect was created for when I started it 14 years ago, as just a little private practice that grew. The biggest problems in healthcare, there's three: access, access, and access. And so certainly with telehealth, that's been a beautiful thing. And COVID really kind of blew the doors open on that. You don't need to let geographical boundaries be a barrier anymore. If you have a phone with a camera or a computer, you likely can find some help. Just make sure that you're getting help from somebody that is qualified, is a professional, and understands the spinning plates when you're dealing with a pilot.
Understand. Did you have anything to add to that, Dr.
Yeah,
Northrup?
we are huge supporters of peer support systems, providing they're trained and providing they make referrals when it's timely. But, I mean, we all know who they're going to call. It certainly isn't the FAA when they've got a question about that. Maybe their wife or their pastor, but more likely it's a peer.
And I will just add to that. So again, that's one of the things that we learned setting up our mental health task force is the industry. I know NetJets has an amazing HAWK program, United SOAR program. We are launching our peer support program based on industry best practices. It is a peer-led, peer-run program. We have 15, we call it Uplift peer supporters, but they're not alone. Again, they were trained in all the resources the university has to offer. We also are hiring an embedded psychologist that'll be the direct support for the peer supporters as well, so they can kind of do that soft handoff for those cases that need to see a mental health professional. But again, it does ease that. They will talk to a peer, they will reach out, and if they're well trained and then well supported, we definitely believe that the industry, the airlines and some corporate companies have really laid the model for us to follow.
Excellent. And what strikes me about that is that in many cases, those are larger organizations. So you're talking, airlines, thousands of pilots, things like that. I want to take a minute to engage the audience here a little bit here. Most business aviation operations, it's a single aircraft, maybe two pilots that are full-time employees. Occasionally they'll have a few more. It kind of depends on the operation and what the investment of that organization is going to be. Probably need to find a way to have a scalable solution for business aviation. And so maybe a quick show of hands, are there folks in the room that kind of feel this is a concern? Would you want to figure out a way that we can, aggregate that support beyond your own organizations or, the boundary of your hangar walls, if you will? Is that a concern? Okay. Yeah, seeing a lot of hands come up. So I think that's a good opportunity as we think about what's next and ways that the committee could work further to help support the industry. So thank you for that. Thank you for that feedback. Beth, what resources, so you talked a little bit about the peer support, but and I think a little bit of engaging some of the other departments within the campus, but for students that needed help, where else did you kind of build your village, so to speak, in providing that care for students at UND, and how is that happening at other universities too?
Good. So one of the benefits that universities have are, every university that I know of has a counseling center. Oftentimes these counseling centers are paid for through student fees. So again, it's not something, if they go and see a counselor at the counseling center, they're not going to need to be billed to insurance. However, we found that our counseling center staff still was a little hesitant or leery of working with aviation students. They kind of labeled them as, I don't want to mess up their career. And so we actually, again, through our partnership with NetJets, learned of a mental health expert that does some training in this arena, kind of aviation mental health savviness for the counselors that aren't familiar. And so we kind of set up a virtual training session just to get our counseling center staff more comfortable with that. We've done a lot more outreach and education for them to serve our students. I also believe that laying that foundation early on, so even simple mental well-being practices, I think we all can spend some time being reminded on how to live healthy and how to take care of ourselves. But I know I've started embedding that into our first orientation course in the curriculum. I used the ICAO book, the Fitness to Fly book that has some good hands-on kind of real practical solutions, and created a little well-being bingo activity, encouraging the students to, take 24 hours off of social media, to actually call a friend from back home. Some of those practices that, again, help us just sort of in life that we need to be reminded about frequently.
Excellent. And I'm just curious too, so that's been work over a year. Do you have data on sort of the take rates or even perceptions on that, how that's going with students?
We've got some initial quantitative data that we've looked at pilot healthcare seeking behavior, but we are launching a larger qualitative study, both military training pilots and university training pilots. That's DoD funded. We're hoping to interview 100 individuals. A sister study is happening in the professional pilot realm as well. So hopefully next year we'll have better insights. Quantitative data is great, but it never tells you the why, and so this qualitative study is really going to try to get to more of the why these are occurring.
Excellent. Great to know that coming. And Dr. Northrup, so you mentioned the AME guide, other things. Are there additional resources that the FAA has put out in support of mental health and mental wellness?
Oh, I've done several webinars on mental health and wellness. How many of you have seen my pilot minutes? Oh, there's a couple. Cool. These are micro-learning events, 60 to 90 seconds. I've got 12 of them out there right now, and one of them's on mental health. It was the hardest one to shoot, actually, trying to figure out how to do that in 90 seconds or less. But there's all kinds of things about how to expedite getting your medical through the system, what medications you shouldn't take and fly, STEM programs, lots of things. Go take a look. So that's one of the things we're trying to do, outreach. Done several articles in the glossy pilot magazines. I go out and talk to groups. Just getting the word out. I've got a cadre of staff that I send out if I can't do it.
Excellent. All good stuff. And I know, as we will continue to build out the NBAA web pages on it, we'll certainly try to bring those, collate all those resources together, if you will, to make that easier for business aviation operators working through these challenges. With that, so I see we've got a little under 10 minutes left here, and we've got a few questions I'm seeing in the social Q&A, and if folks have questions in the room, we do have mic runners, so please try and flag those folks down. Looking into the app, one of the questions I'm seeing here for the social Q&A, what's the FAA's view of pilots applying with bipolar diagnosis without depression? Currently taking antipsychotic medication called, I am going to butcher that, DEPAKOTE, 500-hour student pilot.
Bipolar is one of those specifically disqualifying conditions. Now, that's not to say we haven't looked at them. And occasionally they have flown. Depakote, which is what I think you spelled.
Yes, I think that's what it is.
Because it's also used to treat seizures, is one of those we're really wary about. I would suggest whoever wrote that question, get a hold of one of the pilot advocates and have a good long conversation with one of those folks.
Got it. And then another question here in the social Q&A seeing, how can colleagues in the same operation create peer support best practices, especially in a small operation? And so we talked about that a little bit, but if there's any other thoughts or folks that, well, go ahead.
So I guess one of the companies that we're partnering with to launch Uplift, our peer support program, is based out of the UK. So there's different models. I've learned a lot in the last 12 months on peer support. Most of the airlines in the US fall under ALPA. ALPA takes a very different stance on peer support than carriers over in Europe. And by the way, Europe mandated peer support program for their carriers. So the European model I found kind of mimics more of the services that we offer within a university setting. And so meeting a colleague from British Airways, they connected us with the Center for Aviation Psychology. It's kind of a group that does peer support for a lot of UK carriers, but they also have some larger entities like a rotorcraft peer support program, a business aviation peer support program. So in our conversations earlier with them, we know flight schools come in all shapes and sizes. We know we're a large flight school. We know many smaller ones aren't going to have the resources to possibly develop their own. So as we launch this program at UND and learn what it's like in this training environment, we're more than happy to support what could this look like for a training peer support that is more broadly available for individuals. Again, they can't be trained specifically on that university's resources, but they can be trained on the process and how to be that handoff to the mental health expert and navigating that. So that's something that we would like to explore because we want to improve this for all students in the training field, not just students at our university.
Excellent. And maybe kind of one thought that I've had on things like peer support and supporting mental wellness as you think about the collegiate student programs coming out, and ultimately they're going to enter the workforce one day too. This is kind of akin to a broader conversation we've had on the safety committee. When you think about students that have been in these kind of programs, they've known SMS from day one, they've known FOQA, and ASAP type reporting, all those kind of pieces. And so that's in essence the kind of thing that they're going to be looking for in employers of choice as they do ultimately enter the workforce. So Matt, any thoughts from your end, or just checking in
Well, one thought, I mean, LiftAffect was, we have a contract with a company called CAE that does training for all the airlines. And I can tell you in the first 3 months, this is a pilot dedicated assistance program, which is what we build for companies and training programs. Any certificate holder can have access to the PDAP. And in the first 3 months, we've got a 12% utilization rate. And I don't know if you know anything about EAPs, but a very high utilization rate is about 3%. And with pilots, it's about 0%. So I think what we're seeing is that one is they're promoting it very well. We've done a lot of training seminars with their instructors because they're in the position to refer. That is the peer, that they're interacting with their students pretty closely, and they can, you can train them to recognize behavioral changes. And when the pilots know that they have a safe place to call with somebody that understands what they're going through, it seems that they're much more apt to reach out and use it. So I think peer can be a lot of different ways. It doesn't necessarily have to be structured peer support, but just train. It's like suicide awareness, training people in the community, training peers to recognize early signs and symptoms is the way to, I mean, that's preventive healthcare. That's how to get to it. When a pilot calls a peer support program, that's the end of the line, actually. It's not the beginning. To call somebody that you don't know and say, hey, I think I might have a problem, is this issue has been going on for long before that. So being able to look and recognize signs and symptoms and then how to compassionately outreach to that person, I think is another way of looking at what peer support can look like. That's my thoughts on it.
Excellent. And I'll just say I'm encouraged by those kind of utilization numbers and understanding that makes more for a meaningful connection and into that support. See, we've had, I do see a hand up there. So can we go ahead with the question?
Hello, hi. Doctor, I think I heard you mention that ADHD was a condition that you were potentially reevaluating. Can you expand on that and what we might be able to expect in the future and potentially timeline?
Okay, so I work in Washington. Okay, timelines are never exactly what I want them to be. I've noticed that. But yes, we're looking to see if we can figure out if there's a group with ADD or ADHD that either was misdiagnosed and how we tease that out, or has recovered from it, so it's in remission, or if there's some sort of way to say, maybe a little bit's okay, but this is too much. And it's a very young conversation, because quite frankly, some of my predecessors didn't want to look at that, but we're looking, because I remember even 40 years ago when I was in, okay, it's more than that, when I was in grade school, but there were a lot of kids that got put on medicine that might not have needed it. And unfortunately, once you're labeled, now you got to overcome the label. So figuring out that group is the first thing we're going to try to do. And while I'd like to say it'll happen within a year, we're going to make an initial stab at it, but it may take us a couple of years.
Got it. Do we have other questions in the room? I know we've got a few more on social Q&A, but. Yeah, try and get the mic to work.
Hello, thank you. This is for Dr. Northrup. Do you see an issue at the AME level with, I've known some old school AMEs in my day that might not necessarily encourage people to come in and go through the process and maybe get the help that they need. I know I've known some that kind of want to get your tick and get out. And if you have a problem, maybe they're not the one you'd be looking for. And that kind of ties into the shortage of AMEs as well.
Yeah, so I fully get that not all AMEs are equal. And I've got, like I said, I've got deficits in certain areas of the country. Oddly enough, Aspen, Colorado is one of those. But I am willing to bet that there are groups that can help you find the right AME for your diagnosis to help get it through the system. Many of the pilot advocacy groups have groups or organizations of doctors that they have found work well with their constituents. Sometimes if you're just at the local FBO, somebody will know somebody. So it's worth reaching out to them. Some of the higher volume ones do this more. So yeah, another place you might call is AMAS, which is the other part of the Alpha Aeromedical bunch. They're another advocacy group. So AOP, EAA, AMAS, there's a bunch of them out there, and they keep track. And we're looking for good ones, like I said.
I think, yeah, one other one up here.
Thank you for all that you're doing. The question that comes up in an organization like mine, we have a lot of pilots, and this is a topic that's very near and dear to us. But we also have another part of the workforce, completely unregulated. We have over 500 technicians who don't fall into this category of having to have medicals, who are a very different personality as well than the pilot group. Is there, from an FAA perspective or for regulator perspective, are there any efforts going on behind the scenes to kind of look at the other Part 65 and the other pieces of aviation where we're starting to see a lot of that similar kind of things manifest in different ways?
So technically, I have no regulatory authority over somebody that doesn't have a medical certificate. However, I can tell you there's a push from many arenas that the peer support networks be expanded to include other aviation workers, flight attendants, technicians, so that they are able to have some of the same resources, if you will. Yeah, hands get a little bit tied based on the law.
Got it. I think
Education's still critical, though.
And I think that's a great point too, that even in terms of just best practices and other things that we can do, I can kind of take that as an action for things like the committee to help look at, and how do we find ways to support those other folks. One quick other question here I'm seeing, and I know we're nearly running out of time. So when the question came in, when you say psychiatrist, does that refer to HIMS psychiatry? If so, why is that number so low? I'm not sure I'm totally following the question, but there is.
On my staff? Oh, for years we only had one. Bart Packle, for anybody that's been around long enough. And then we had Charlie Chesnow as the only one. And then we added Chris Flynn about 2 years ago, 2.5 years ago. And we've seen a need to grow that number within the FAA. HIMS AME, or HIMS psychiatrists, the number is still on the low, well, it's low. We'll just call it what it is. But we're continuing to try to recruit to those positions. It is a bit of a labor of love for the people that work in the HIMS program. One of the reasons we have them working with the SSRI program is because we can train them. They have recurrent training requirements. But that's not to say that all mental health diagnoses need to be evaluated by a HIMS psychiatrist. Not all of them do. The basic ones, just, whoever's treating them.
Okay, and I see one last question that we hadn't really discussed. So what are your thoughts on integrating fitness for duty checklists into a flight department's safety management system? Is that an effective way to identify health issues that could impact a pilot's performance?
How many of you use I'm Safe?
Yeah.
That's a really good one. One of my pilot minutes is on that, actually. Because as pilots, we all self-certify. When we step to the airplane, 14 CFR 61.53 applies. And that says, and I'm paraphrasing, we shouldn't be flying if we know we should not be for a medical deficiency or a mental deficiency. So it's important that we remember that, and every time we step to the airplane, we need to consider, are we ready to get in that airplane? Are we ready to take off? Oh gosh, that was a soapbox, sorry.
Excellent. I want to thank, really with our time today coming to a close here, and thanks for the indulgence of running over a couple minutes. We've covered a lot of waterfront here on aviation mental health and its importance. We've talked about what mental health is and really some of the common health challenges, recent events that have highlighted the importance of mental health, how we can support our mental wellness and that of others in our professional and personal circles, and then ultimately some of those FAA medical certificate impacts. So thankful for that conversation. Thankful to be joined by the fellow panelists here. So thank you, Dr. Northrup. Thank you, Dr. Burke, and thanks, Matt, for joining us for your incredible insights to this whole conversation. And I want to thank you, the audience, for your engagement. Really appreciate the questions and the active interest. Keep the phone calls coming and things like that too. Happy to help and be a resource as NBA for anybody working through these things to work through these issues. And with that, thanks again for attending. Hope you have a great rest of the base. Look forward to seeing you back in here for other National Safety Forum sessions the rest of this week. Thank you all.